Hi, I'm Dr. Karthikeyan, microsurgical andrologist and urologist at Apollo Hospital, Screenford, Chennai. In this video, we are going to see about what is erectile dysfunction, why it happens, and what are the treatment options, and in some more depth about penile implants. So basically, we all know that penile erection happens during intimacy, and for an erection to happen, we have to understand that blood has to flow into the penis. So this is the basic anatomy, where we see that this is the bladder, this is the prostate gland, and this is the penis. In this penis, we have two parts. One is the area where erection happens, and this is the urine passage through which the urine and the semen come out. So if we open this penis and then see inside what happens, so this is how it appears. So this is the penis. Inside there are two rod-like structures. These are the cylinders, we call it corpora in medical terms. And this is the urethra, which is transporting the urine and the semen from the body to the outside. So here if we see, inside the penis, inside these two rods, there are multiple small structures called the cavernous smooth muscle and the blood vessels. So here what we see is blood starts flowing into this thing, and each small blood vessel, which is the end of a blood vessel, like this it is there and it becomes big like that. So when an erection has to happen, each of the individual, whatever these smaller structures have to become big, and then the overall penis erection happens. So there are two such structures, and whenever the blood flow is not good, it means that blood is not flowing here properly. So we have to mainly understand that it is not one artery which is giving the erection. These things divide into multiple small things, and into each thing blood flows and it has to become big. So in the OPD, as an andrologist, what we do is, we do one more additional thing. The additional thing is, we assess the erection in a more objective way. So assessing an erection, asking the patient or the partner what is erection, how is it improving, these things may be difficult. So we have something called the erection hardness score tool. So this is 1 to 4. This is like the patient is asked to touch and feel it, how it feels during an erection. So this is a basic soft penis, which is called the erection hardness score 1, and this is the erection hardness score 4. So 1, 2, this is 3, and this is 4. So this is not only soft, but it is easily bendable. This is not only hard, but it is not bendable. So number 2 is slightly better than this, but this is also bendable. Well, this is firm. Even though it is not so hard, it is up to a great extent it is hard. So our goal of treatment usually is to bring the erection to either 3 or 4, which gives good satisfaction. So now next, whenever the brain thinks, the brain sends an impulse through the spinal cord to the nerves. There is a nerve which connects the spinal cord to the penis, and through that nerve the signal reaches the penis. In this end of the nerve, there are some chemicals which are released, which then opens these blood vessels which I showed, and then an erection happens. So this is how an erection happens. So whenever we have erection problems, there are two major categories of problem. One is something in the mind. So when the patient is anxious, he has lot of concerns, confusions, etc. Then the interest to have sex, or the free flow of blood, the free impulse travel from the brain to the spinal cord, that doesn't happen. Therefore, the erection doesn't happen. Here it may be that all these blood vessels are normal, but since the patient doesn't think or is confused, then the erection doesn't happen. The second thing is, there is a problem in the body. That means either the blood flow is not happening, or the hormones are not normal. That is why the erection is not happening properly. So it may be a blood flow problem or a hormone related problem. So now coming to the treatment options, we have a minimum of 3 to 4 good standard treatment options available for erectile dysfunction. One is tablets, second is intrapenile injections, third is operation, and fourth is vacuum erection device. These are the 4 main things. Additionally, we also have newer treatment options like platelet-rich plasma or the P-shot, shockwave therapy, and also the stem cell therapy. We also identify if there is a hormone problem, especially testosterone, and then do treatment with the testosterone replacement. So these are the various treatment options available. Today in this video, we are going to focus more on penile implants. There are two major categories of penile implants. One is a malleable implant and another is called the inflatable implant. So again, we are going to see here. So a malleable implant is a model where the penis is always rigid. So here the implants which are used are solid. Therefore, the implants are placed in the penis and the penis is always hard. Whereas in an inflatable implant, it contains multiple parts. This is the 3-piece implant where there are implants placed inside the corpora, which is the place where I mentioned the blood flow happens. And there is a pump and there is a reservoir. So this is a multi-component device. And here, because of the pump and the reservoir, the water from here comes to this point when erection happens. And that action is facilitated by this pump. So whenever the patient presses the pump, water from the reservoir comes into this implant and the penis becomes hard. And whenever the act is completed, again there is a release button with which the water entirely goes back to the place and the penis becomes normal. So the essential difference between a malleable implant and an inflatable implant is, here the penis is always hard, always rigid, while in an inflatable implant, it can be made erect or soft by using the switch. So this is the basic difference between malleable and inflatable implants. We now have so many varieties of malleable implants available in India. Earlier in the market, we had mainly the Indian implant, that is the Shah's penile processes, while nowadays we have a lot of imported implants. All these things are available and we are doing all these surgeries here. So we have 1, 2, 3 and 4. These are the other 4 models. So the essential difference between this model and the other models is that in this model, the penis usually remains hard and bending becomes little difficult. While in these models, these are called the cable processes or the hinge processes, where we have more bending is possible. So the patient may be able to keep the penis built in this position. While in this model, usually the bending may happen, but there is a small hinge which facilitates the bending. So the other differences are, these are important models and each model has some individual differences. So we are going to have a look at all these implants. So on the table here we have all the models displayed. So this is the inflatable implant. These are the inflatable models. So this is the 3-piece implant which I told. So this is the pump, this is the reservoir, and these are the cylinders which go into the penis. And this is a 2-piece model where there is no reservoir, okay. So these are the 2 cylinders and this is the pump. These are essentially the same like this. But this reservoir is extra here, which makes it 3-piece and this is 2-piece. We also have various malleable models. So this is the Indian model of the Shah's processes, which is like a silicone implant with a hinge here. So the patient can keep this like this. We also have other models like this is the Zephyr, this is the Tactra, and this is the Tube. We also have the Rigicon. So what is the difference? What is the difference between these two models is, this contains the ring or the core, whatever we say, which can hold this implant in the belt position. So all these models are like this. So they can be held in this position. So it makes little more comfort for the patient to what we call concealing the implant. So the basic idea or the difference between these two models. So this is the inflatable and this is the malleable. Here, because of the presence of the pump and the water in this area, the reservoir, this implant can become big and become small, while this implant, it is always hard. So we have one more video, the photos which show that this is the same thing which I mentioned here. So with the hand, the patient can hold the penis, like the penis can be kept like this, and whenever required, it can be straightened like this. But these implants are also hard, they are not soft. So these implants, even though they are a little different from the Indian implant, they also still come under the malleable category, where this is a solid implant. So there is no It cannot become big or small, it will stay in this rigidity only. So this is now going to this model. So here again we have multiple models. We have the AMS, we have the Zephyr. So these models, as I mentioned, these are all 3-piece implants and this is the 2-piece implant. So we have to understand how this works. So this is the reservoir. This is the pump and that is the cylinder. So whenever the patient pumps this with the hand, water from here goes there. The penis becomes rigid. With this button, it becomes soft. So whenever a patient comes to us, they ask for each model. What is the difference between a malleable and an inflatable? And what is the difference between the Indian implant and the foreign implants? So we choose implants based on various things. What is the age of the patient? Whether the patient will be able to use the pump? What is the financial affordability? What does the patient want? How much idea the patient has about the implant? So we have other frequently asked questions. Whether an implant is safe. The implant is usually safe with a rare chance of infection, which is around 1%, and a rare chance of injury to the urethra. So I mentioned that in the penis, this is the urethra and this is the area where we are doing the implant surgery. There may be a rare chance that there may be some urethral problem. As urologists, we know how to take care of the urethra, and in every implant surgery, the urethra, first the patient is catheterized and we know where the urethra is. So we don't usually go and damage it. Similarly, every patient before implant undergoes an evaluation to see whether the urethral passage is normal. We do get a lot of patients above 55-60 years who come with, say, prostate problems or rarely problems in the urethra. In these patients, this surgery and this treatment is completed before even we go for the implant. So it's very rare in the hands of the andrologist that we damage the urethra. But still, in any surgery, there may be a small chance of urethral injury, which is in the order of say 1 to 2% or maximum of 3%. That's a very rare complication. The more commoner expected, the only issue which can happen in an implant is an infection. Again, we do so many cases and the chances of infection are made less by preoperative sugar control, good antibiotic coverage around the time of surgery, and strict infection control. So we do scrubbing in the patient. We try to eliminate infection to the maximum. These patients are usually done as morning first case. We clean the OT thoroughly, sterilize the OT, sterilize the instruments. We do so many things which makes the surgery, the chances of infection being very less. So these are the two main important complications which we can expect. Other than that, usually the surgery is a very safe surgery to undergo, especially in centers of excellence. And we also expect results within the first 4 to 6 weeks. As in any surgery, patients may develop a mild infection, some swelling, edema, fever, etc., which usually settle down within 7 to 10 days. The patients in whom they may have some problem with urination, these patients are dealt with primarily for the urine problem, and then we go for the penile implant operation. So other than this, we also have some frequent questions whether the costlier 3-piece implant and the Indian implant can give the same result. Usually the implant is done only to give a solid and a good erection. Other than that, all aspects of usual sexual intercourse should be followed. So it is not really what type of implant is being used. Any implant can usually give the same success. And the success rate of the implant is not based only on the surgery. We do counseling for the husband and the wife or the partner. This is because both the partners have to understand what they expect from sex, why they came to us for an implant, and how do they get rehabilitated after doing an implant surgery. The implant surgery mainly takes care of having a strong rigid erection, and it takes care of penetrative intercourse. Other than that, the implant doesn't contribute to interest, it doesn't contribute to as a replacement to foreplay, and it is not done for premature ejaculation. So these are the most important points which we have to remember. The nature of the implant or the type of implant doesn't alter the outcome. Even the simplest implant or the costliest implant can give the same result. It is only what is the comfort, what is the acceptability, and what is the expectation. So these are on the basis of which we decide the implant, and most of our patients choose the implant based on whatever we have discussed. In our OPD, we don't choose the implant for the patient. It is always the patient and the partner who choose the implant. We also always prefer that we do a couple counseling. Counseling for an implant usually takes around 20 to 30 minutes, and these are all the information which we speak to the patient. They have to also understand that implant is an irreversible procedure. Once it is done forever. So we try all the methods and medicines available under the roof to improve the erection. This not only includes medications, it includes stress control, sugar control, medical therapy, weight reduction, lifestyle change, diet. There are so many things which are being done. When we offer an implant to a patient, we have exhausted all the treatment options before we go for this surgery. So it's very, very important that we know for what we are doing this surgery, when to do this surgery, and what to expect out of this surgery. Once we have taken care of all these things, the end result of a penile implant is very good and very satisfying, and both the husband and the wife are usually very happy with the implant because it gives a good erection, a stable erection, which was missing in their lives so far. So if you want to undergo an implant surgery, please take the information from the doctor, go through it, understand it clearly, and then choose the surgery. Don't go by what is the price of the implant or which company it is. It is usually that the implant which is placed in the penis gives a good, strong, rigid erection, not what company or a costly implant can give a better erection and the cheaper implant can give a lesser erection. It is not like that. So whatever the patient wants, whatever the doctor explains, based on the anatomy, so what is there for the patient and which implant will suit him the best, there are so many things which have to be discussed. Thank you for your patience.